trend. So we've stopped that exponential growth curve that would have overwhelmed our hospitals. We are now have to figure out how we can make this sustainable and create a sustainable way of life for the future. As you can see on this chart, things have been fairly stable, and it's really testimony to your work, staying at home whenever you can, and having social distancing and hopefully wearing masks when you go out. You taking on that individual responsibility is showing great success. We certainly hope that we can maintain this work. Keep in mind that there's an 8 to 12 day lag in people who are being hospitalized versus who's being exposed. A second piece of good news, we have the first application from a county to reopen and end a stay-at-home order, Eagle County, Colorado. Which has lost so many iconic members of their community. Musician Rod Powell, entertainment and hospitality manager Bob Lazier, who ran several businesses. I mean, these are folks that almost everybody in Eagle County knows. Eagle County has really gotten their act together. They're the first county that really has applied for being able to end the stay-at-home a little bit early. Remember, they issued the first health orders a little bit early. So because it was a hot spot, skiers brought it in. They started having more restrictions ahead of the rest of the state. But they now have a sustained decrease for the last 14 days. They showed that hospitals are able to treat patients in Eagle County. They're able to perform testing for all people with symptoms in Eagle County. They've done a great job ramping up testing. We want to support other counties in doing that as well. And they have ability through Eagle County Health to actively monitor and do work for tracing for their COVID-19 cases and those contacts. So it'll take a few days to work out the details with Jill Ryan, our head of Department of Public Health, but I'm very much looking forward to and expecting to be in Eagle County on Thursday or Friday of this week, and hopefully joining the Department of Public Health in signing the very first county that is able to open in Colorado. It's been a long haul for Eagle County, at least 7 deaths. Many that are still hospitalized and likely more deaths ahead. But they've done a great job in preparing that work, in scaling up the testing, in creating the parameters for making sure that stores can be safe. And in many ways, since they issued those public health orders a little bit earlier than the rest of the state, it's kind of showing where we are headed as the rest of the state shortly. This afternoon, I want to share some of the modeling work before we get to the steps we all want to know what gets ahead. This is really important because while we have over 10,000 cases in Colorado, we believe the real number is significantly higher. Dr. Rachel Herlihy worked with Dr. Jonathan Samet of CU. He's the head of the Anschutz School of Public Health. And interestingly enough, his professional background, he's internationally renowned in public health. We're so happy to have him in Colorado. I'm going to start calling him Colorado's Dr. Fauci. But his actual clinical background is pulmonology, which means he was a lung doctor. It couldn't be more relevant with that clinical insight with his public health lens into this crisis. He worked with our state epidemiologist, Dr. Rachel Herlihy, on this model. And I want to be clear, as governor, I look at all the models out there. You create a model, we look at it. This is in many ways the most relevant and the one we look at the closest because it's prepared on the ground with the relevant Colorado information. We look at national models, we look at international models, and we have a data team that gives us proxies for mobility. But this modeling work, which was just released today, is incredibly important. And I wanted you, members of the general public, to have a sense of this information that is informing all the decisions that we're making in state and county health departments. And with that, I'll turn it over to Dr. Rachel Herlihy.
Good afternoon. As the governor mentioned, the number of cases that we've identified here in the state is just over 10,000, but we believe that number is actually probably closer to 65,000 or 75,000 as this figure shows. And that is really based on the modeling work that we are doing, as well as our understanding of rates of asymptomatic transmission, as well as symptomatic transmission. And so this data gives us a bigger picture, a better picture of really what transmission here in the state looks like. And so these figures estimate that we have probably between 1.1 and 1.3% of Colorado's population that has been infected to date. Next slide. So what I want to talk about is the modeling work that we've been doing together with the University of Colorado, and also talk a little bit about the scenarios that we've been looking at, the questions we've been trying to answer with data to really move us into a phase of trying to understand what comes after a stay-at-home order. And so what I'm going to walk you through today is a variety of scenarios that present to us different options for moving away from a stay-at-home order to different strategies. And so that I'm going to present to you is the first scenario, and that shows us what it looks like to maintain a sustainable level of social distancing by the general public, but not combined with any other initiatives. Scenario B shows us maintaining a sustainable level of social distancing by the general public, plus advising older adults, those over the age of 60, to maintain high levels of social distancing. So that means perhaps greater social distancing for that population than the general public. Scenario C looks at maintaining a sustainable level of social distancing and promoting mask wearing by the public, as we're doing now. Next slide. So scenario D then looks at maintaining a sustainable level of social distancing and pursuing aggressive case detection and containment, so using our public health disease control strategies. And then scenarios E and F are a combination of those. So scenario E is a combination of A, C, and D, so maintaining a sustainable level of social distancing, promoting mask wearing, and pursuing aggressive case detection and containment. And then scenario F is really a combination of all of those strategies. So first, to walk you through scenario A. As we've been discussing and using as sort of a North Star for our modeling work, what we really are following and using as our upper limit for the amount of transmission that can occur in the state without exceeding our healthcare capacity is the number of ICU beds available in the state. So if you look at the right figure here, you'll see a dotted white line that is right around 2,000. And that really represents the number of ICU beds that we have available in the state. And our goal is to stay below that dotted white line. And so what you can see in the different colored curves here is different levels of social distancing. So 35% up to 65%. And you can see, again, this is scenario A with just social distancing strategies in place. And you can see that with just social distancing at those levels, we unfortunately exceed that ICU bed threshold. And this shows you the peak number of infections, peak number of ICU hospitalizations, and peak ICU hospitalizations that would be associated with scenario A at various levels of social distancing, so 35 to 65%. And again, you can see here that for all of those scenarios, we exceed the number of ICU beds available in the state. So to conclude then, social distancing alone, scenario A, is not sufficient for moving forward. We need additional strategies. So scenario B combines social distancing at the levels we discussed previously with greater social distancing for older adults. And what you can see here, again, the same dotted white line at 2,000, you can see at 65% social distancing, we stay below that threshold. So if we combine 65% social distancing with greater distancing for older adults, that results in us not exceeding our ICU bed threshold. That meets our goal. Next slide. Again, scenario C is mask wearing. So this combines our social distancing strategies at 65%, 55%, and 45%. And you can see that mask wearing plus social distancing stays below that ICU bed threshold. Scenario D looks at case detection and isolation. Again, those public health disease control strategies that we want to use. Scenario E looks at masks and case detection and isolation and stays below that ICU bed threshold. Scenario F includes all interventions, and that really shows us our best shot at staying below that ICU bed threshold. We can see that with all of those combined at 65%, we stay well below that ICU bed threshold. And at 55%, we also stay below. So it gives us a little bit of wiggle room there on achieving the amount of social distancing we're trying to achieve. So this figure shows you, or this table shows you, the number of ICU beds needed at peak for each of these various scenarios. And you can see circled in yellow are the number of strategies that result in our ICU bed threshold not being exceeded. But you can see that really our best approach is scenario F, where we use a combination of strategies to really decrease the amount of transmission that is occurring in our state and ensure that we're not going to exceed our healthcare capacity. So takeaways: we must maintain sustainable high levels of social distancing. Seniors and vulnerable populations need to maintain even higher levels of social distancing. Each intervention, so testing, containment, wearing masks, sustainable social distancing, strong precautions for seniors and vulnerable populations alone do not keep us below hospital capacity. A successful strategy is a combination of all of these interventions. Thank you.
So each of these components, wearing masks, protecting our most vulnerable, the testing and tracing, the social distancing, these are all parts of what we need to do to maximize the amount of activity that we can engage in. So, it's like you wear a mask, you get 6 points. You get the extra point for the Broncos mask. Like, after you get a touchdown for 6, you get the extra point. We'll give a solo shot point, 1 point for Rocky's mask too. But seriously, whatever you can do that covers your nose and your mouth works. Part of the benefit of a mask when you're out, you don't have to wear them at home. When you're out, is it prevents you from touching your mouth and your nose. Very important to wear whenever you're shopping, whenever you're around others. It can help save your life and save the life of others. It's absolutely important to do that. Protecting our most vulnerable, those over 70, those over 65, those with pre-existing conditions. Of course, the increased ramp up of the testing and the epidemiology work and the isolation of people who have it. All of these are important parts. This is the piece that we presented last week that guides our decision making, right? The work to suppress the virus, increasing the ability to conduct testing and containment. The additional protections for those who are most at risk for COVID-19. We are now ensuring that people at all the nursing homes and stores should be wearing masks. Of course, guiding overall that the ability of our healthcare system, that we have enough ICU beds and beds for those that are affected in the months ahead. And we want to make sure it's sustainable. That means people have to be able to earn a living, right? You have to be able to leave your house. The stay at home is the most, is the most difficult and hard step. And it had to stop that exponential increase. It is succeeding. We have some more time that we need to do it. But as it rolls off April 27th, we need to figure out how we can run the marathon now that we've run this sprint. And sometimes the marathon's harder than a sprint. I've never run a marathon, and for anybody who has out there, you know how much training and how difficult that is. I hate to break it to you, but the easy part was the sprint, right? Now we need to pace ourselves and figure out how we can live our lives, support ourselves, be able to work, be able to shop and do some of the things we love, but do it in a way that is different and that has a lot less social interactions, right? For every 10 social interactions, if you socialize with 10 people a day, you have to, in this new period in May and June, however long it lasts, instead of 10, you need to have 4 social interactions. If you were somebody who had 20 a day with people, you need to have about 8 a day. So that's kind of the pacing that we need to have to be able to do this, as finally this extreme effort of which is in almost every country in the world and many and all the states of this kind of staying at home and not even being able to go to work ends. So it's a marathon, and I want to make sure everybody's ready for that. We need the will to sustain it in the coming months. It depends on our success will be indicated by our individual responsibility, by your individual responsibility, by your choices, the choices of your friends and neighbors. That is how we are going to do this. And we're going to do this together, and we're going to make sure that as this virus continues to rampage, this deadly virus, we take all the steps we can to protect our most vulnerable who are affected at much higher rates. And just to highlight the need of that, overall, about 1 in 10 people will need to go to the hospital with COVID. That means 9 in 10 recover at home. Once they are free of symptoms for 3 or 4 days, they can go out again. 1 in 10 overall. But as you dig down in those numbers, you find that is much higher for people in their 70s, 80s, 90s. For people in the 70s, 80s, and 90s, it's almost like Russian roulette, with a pistol. It's a 1 in 6 or 1 in 8. I mean, you're going to have rates of 20, 25%, 15%, 20% that are going to need to be hospitalized, very high rates, and then worse clinical outcomes, meaning a much higher death rate. And of course, while it is safer for people in their 20s and 30s, it absolutely can be fatal. I mean, we lost a 21-year-old baseball player at Colorado Mesa University from Arapahoe County, went to Rangeview the other day, and sadly there will be more young people as well, but it's a much lower rate overall. So what does all this mean? Here's the upshot. The modeling tells us that as a stay-at-home order expires, we need to keep up a level of 60 to 65%, less interactions, less meeting with friends, less hanging out with others, for a period of time. We're much higher than that now. We're at 75 to 80%. Now, you might be saying, wait a minute, I've been staying at home, I've interacted with no one. What do you mean I'm at 100%? Because your family unit there doesn't count. If you're with 4 people and you've been hunkered down for 2 weeks and not seen anybody, yes, you're at 100%. But keep in mind, this average also includes all those people of the critical workforce that are actually still going in and encountering 15 people or 20 people or 10 people. So average overall, based on the way that the virus has plateaued and come down a little, we think we've been in that 75 to 80% social distancing range for the last couple weeks, and we will for the next week too. As the stay-at-home rolls off, we need to be able to maintain a marathon, right? Months, a month, 2 months, however long it takes, right? We hope there's cures, we hope there's vaccines, herd immunity will build, all of these things. But for a while, we need to pace ourselves and earn a living, support our livelihood, be able to pay your bills, have some enjoyment, fulfillment out of life. Doesn't mean you're going to big nightclubs, but you shop for clothes, all that stuff, get a haircut. I need it. We all need it. And that is that 60 to 65% range, right? And so that's what's rolling on in this April 27th to kind of May 4th period that we're going to be talking about. And that needs to be sustainable, subject to changes that need to be made by county health or by the state along the way, right? This is new territory for everybody. And if it starts to take off, and remember, we'll be watching those indicators, early indicators, lagging indicators, it's certainly possible the exact parameters of this could even shift over May. But we're starting with something that we're confident in. It really depends on individual responsibility. Your decisions, your decision to wear a mask, your decisions to limit your social interactions with others. If you can stay at home, of course continue to stay at home through early May. It's dangerous out there, right? Not everybody can stay at home. We get that. We want to make it as safe for you as possible. And the stay-at-home order was successful. It cut social interactions 75 to 80%. And now we need to go into, as that expires, how we can maintain this in a sustainable way for a while and have that emotional fulfillment, the psychological fulfillment, earn our economic livelihoods in a way for a period of time. May, it could even well be June, beyond that we need to live. It's a marathon, not a sprint, because we're going to have to live with coronavirus for a while. And we need to make sure that we live not with anxiety, not with fear, but with extreme caution. And that extreme caution is driven by the data, right? We can't live our lives in fear, but we should practice caution, wearing masks whenever you leave your house. Still, only going out when you need to, right? Keeping distance from others, all of those things as we set into a pattern that gets Colorado through the difficult months ahead. Let's go to the next slide here. This shows the different levels of kind of what we're focused on here. The stay-at-home period is ending. We're going into safer at home. That's a good title for it. Of course, you're safer at home. If you're part of our most vulnerable population, you need to continue to isolate to the maximum extent possible. I mean, my parents, 75 years old. Actually, my dad just turned 76. My mom will turn 76 next month. They need to stay at home, and they are. Groceries are being delivered, or people are helping, but they're not leaving. My mom has some pre-existing respiratory conditions, as many people her age do, in particular caution. So for the most vulnerable, additional precautions at the nursing homes, the senior care facilities, we're taking them now. In fact, we are using the Colorado National Guard to begin testing, supportive testing for workers at some of the larger facilities, working our way down, starting with the biggest ones. Biggest bang for our limited resources and reducing transmission. And we're doing our best to get very serious about enforcement at all of those facilities. And if you live on your own and you're 78 or you're 85, of course you want to continue to stay at home except when absolutely necessary, right? Your May will look a lot like your April if you're 75 or 80. And that's going to be important because this is Russian roulette. at that age. And we want to make sure that you are taking that responsibility seriously to keep yourself safe. And that does mean, in many ways, putting off those extended family visits with the grandkids and the family and the nieces and nephews and all those kinds of things that could put you at a great risk. And I know it's hard, but I know you'd much rather have a whole lifetime with them than risk seeing them, in this coming month and knowing that could lead to a shorter lifespan and less enjoyment, of your golden years. And protecting our neighbors is still a way off, of course, and that's that phase as we're able to get down to 40% social distancing, 45% even lower. And of course, we all look forward to the day when there's a vaccine, an effective cure, or herd immunity, when we can once again embrace one another and pack in at the stadiums and watch our favorite football teams and baseball teams. And we look forward to those events as well as busy nightclubs. We can't lose sight of the fact that our job isn't finished. Your job isn't finished, not by a long shot. This all hinges on individual choices and the individual responsibility of Coloradans. That's choices to do what you need to, setting a pace here where you're psychologically fulfilled, emotionally fulfilled, able to support yourself, and then minimizing your other interactions for the next month or beyond. Today's data shows that while we can take it down a level because we need to for sustainability, we know that people can't, it's not possible to keep up staying at home. Most people need to earn a livelihood. People just need to set into a more healthy pattern from an emotional and psychological perspective. We want to set the parameters of that pattern and really make sure that everybody can be ready for this marathon and complete this marathon. I want to talk with you now about how things will look on April 27th. And these policies are still, we're working on the guidelines and the implementation for them. That will occur before April 27th, so you'll be getting, for instance, as we talk about retail stores opening, they will probably look a lot like the critical retailers, the essential retailers today, meaning, if you've been to the grocery store, and I hope you've avoided it if you can, but many of you have to go to the grocery store, you've probably seen they have spacing, and many of them have one-way aisles. If they have decals on the floor, they should all by now have every employee wearing a face mask. If not, you should report them to your county health and others, but they've been very good in doing that. All of that work to keep you as safe as possible, and you should wear a face mask when you go shopping as well. That's the same for all shopping, right? But we're working on those particular guidelines around that. And first of all, the general population, of course, the stay-at-home order expires, as we talked about, but it's still important, we call it safer at home, to stay at home whenever you can, right? The less social actions, targeting that 65% range. So if you used to be a social butterfly and interact with, 50 people a day, you're, now interacting with, 35% of that, 15, 18 people, whatever it is a day. Critical businesses, of course, stay open with strict precautions. Nursing homes and congregate care facilities we're continuing to increase the work on that. And then, of course, retail curbside delivery. Any retailer that wants to do that starts immediately April 27th. And then those that want to can open for the general public May 1st. What I say, those that want to, not all of them will have the guidelines in place like the critical retailers do. Some might feel there's not enough customers and they don't want to open, or they don't want to put themselves at risk. But again, we're still encouraging that if you are a member of a vulnerable population, that you avoid those social interactions whenever you can. Next slide here. So the non-critical offices. This is Colorado's commercial capacity. There's a weekend there. So May 1st, I think, is a Friday. So rather than start Friday, you just buy a little extra time. So I think going back May 4th at 50% capacity. And all those commercial offices, large workplaces are advised to have symptoms and temperature checks as people enter. Very important, very effective, big part of what's made South Korea and Taiwan successful. Telecommuting should be maximized. And part of that is making accommodations for seniors and vulnerable populations that work for you. Not every 70-year-old is retired. Not every 60-year-old with a pre-existing condition is retired. Many of them are in the workforce. And as you're an employer that is looking to have 50% on site, there's several ways that you can do that, right? If you're a kind of company that the work can only be done on site, let's say you're manufacturing, you might need to have 2 shifts instead of 1. Right, where half your employees are there at one time and then half your employees are there at another. If you're already running 2 shifts, you might have to go to 3 shifts, right, if you still have that capacity. Now, for many other types of employers, software, whatever it is, many employees can telecommute. And in the 50% that aren't able to go into the workplace because we have to reduce that density, we want to make sure that you prioritize those who are most vulnerable for those telecommuting opportunities. And we're issuing that similar to CDC guidance about who's vulnerable. I think we're adding in pregnant women to those with pre-existing conditions, moderate asthma, above a certain age. The telecommuting availability should be maximized for those who are most vulnerable to help protect them. And it really just depends on your business. Let me talk about the state. We're an employer. We've been in the 70 to 80% telecommuting range since the last couple of weeks. Now, we are one of these essential, critical employers, right? The state is going to continue to function. And yet we've managed to be able to do it with only about 20 to 30% physically coming in. Now, that'll probably increase a bit, right? 40, 50%, whatever it is. But we want to sustain that social distancing to the extent we can as an employer of 31,000 people. And it's tough because some jobs have to come in every day. If they're clearing the snow, CDOT, if you're guarding, if you're a prison guard, if you're a state trooper, I mean, those are all working. But for many of our office positions, yes, more of them are going to be coming in, but we're working very creatively to keep the maximum number telecommuting that we can. And every good employer is doing that, small, medium, and large. And we need to continue to do that, just as we challenge the critical employers that have been functioning through this entire period to be able to have that social distancing enshrined. Just because they've been critical doesn't mean they should have been running at 100% capacity. We put in that, in the order, you have to, whatever you can allow telecommuting, include social distancing, run multiple shifts if you can. So those kinds of protections are now very much part of the world for the rest of the companies that are, and employers that are coming back online. So let's go to the next slide. Okay, let's go back one actually. So I didn't cover all these just so it's a little more detail. This will all be forthcoming, but we have the goals for distancing, of course. Something like real estate. People have asked about when can people show homes, but people have been able to buy and sell homes through all of this, by the way. I have friends who have. But that's April 27th. That's the one-on-one showing. But there's not the open houses, right? Because the size limitation is gatherings of 10 or more. So private showings, absolutely. All those personal services that we need. And that's, the haircuts, the dental, all of that. Coming back in after the expiration of the stay-at-home order, as long as the precautions are taken, right? So now in the dental offices, they already largely wore surgical masks, but maybe the administrative person didn't out front. Now she or he will be too. In addition to the dental technician, the dentist, they'll be taking all those precautions that they need to. But in other kinds of businesses like salons, they're not as accustomed to, and sometimes in nail salons they wear surgical masks, but in hair salons they didn't. They will. They will. We want to keep people who are safe, both the customer and the person who is doing that. So that's extremely important. There's also likely to be guidance just around people not waiting in the lobby, and not. You're not socializing like they used to, right? Some people used to go to hair salons for fun and hanging out with people and socializing. We're not there, right? That's not going to be safe. Going in for a haircut and how that works will be safe, not safer, and there'll be a way that is done. During this period, of course, elective surgeries are also coming back. And, I never liked the term elective surgery because they're not entirely elective, right? These are things that people need, and it's been very frustrating. I've had people say, I have a sore tooth, I can't get in because it's not an emergency, but I need to do something, my crown broke. Knee replacement, they can't walk, they're waiting for it. All that stuff is coming back. With precautions, and you'll be able to schedule that, shortly and get that done. Bars and restaurants and clubs and all those things and event venues are staying closed. We're hoping in this phase to have a phased-in reopening of restaurants. We don't have the date for that yet or the parameters for that yet. I mean, my own goal would be mid-May. We're hoping that they can come back. That means reduced capacity, distancing in place for the restaurants that want it, right? Obviously, curbside delivers for all of them. But those parameters around reducing the density, what the additional precautions they're taking, my goal would be to bring that back as soon as possible. But honestly, it's probably going to have to wait till the first data comes in from these other measures, right? And that takes, unfortunately, 2 weeks. So we'll prepare all those best practices. but I don't think that it's unlikely it can go live with restaurants until we have some data on the retail and the 50% workplace density and all that. Then we'll be able to make that decision mid-May. Okay, can workplaces go up to 70% or not, or do they have to go back? Do restaurants open at half capacity? I can't wait till we get there, because frankly, at the end of this, we want to have restaurants. We want our small businesses to be in business, and we know that the longer this goes with them only being able to do delivery and takeout, the less they'll be able to hire back their workforce. And we want to make sure that while we're managing those who need hospitalization, we don't want to run out of beds. That's where, we've expanded beds. But we want to make sure that every Coloradan who contracts coronavirus, and absent a vaccine or cure, it'll be most of us, right? I mean, it could be 50, 60, 70% of Coloradans who get this, but they can't get it all at once, right? That's what we have to prevent, because then you go to the situation where there's mass casualties because people who should be administered oxygen can't get a bed, and the few who need to go into ventilators can't get a vent. So it's really important that we are in this for the long haul and that we protect those who are most at risk that have a much higher fatality rate. Next slide, please. Look, this is not going back to normal, but there's also a process where we know that there's different situations in different parts of the state. And while I'll be excited to join Jill Ryan when she signs Eagle County being able to move forward ahead of the state, and there's likely to be other applications, we have to be on the ball. That means that county health departments, if there's a hot spot, they need to be able to act quickly. Now, that may mean, at times, taking countywide steps. We hope it doesn't come to that, but what it very likely means is, okay, there's an outbreak at this plant or facility, we're going to lock it down. There's a community-wide, in a big, diverse county, outbreak. We're going to have an impact on that neighborhood or community where there's a temporary stay-at-home in that area, but that prevents us from having to do any of these statewide measures. So county health departments are going to be on the ball, doing targeted approaches. If they need to countywide, we hope not. And then on the other end, there's many counties that are further along, right? We support their testing, but they may be able to gear up testing, right? Eagle County, I think Pitkin County bought 1,000 additional tests. So we want counties to get ahead on the testing, the tracing, the best practices for their stores, and there's going to be that process in place where they're able to get that waiver to go faster than the state. And maybe it's just less prevalence of the virus in your area and not a lot of people coming from areas that have it, right? It's going to be a function of both, right? Just because you don't have it in your area, you don't want to be in a situation where you're welcoming in a bunch of people from areas that do have it and all of a sudden you do have it in your area. But there should not be, in a big diverse state, there should not be one statewide approach. And we know the situation is going to be different in Otero County, in Pitkin County, in Rio Blanco County, in La Plata County, and that flexibility is going to be very important. How well prepared is the county health department? We're happy to support them scaling up testing. How well have they done that? How well have they implemented the safety measures, and are they ready to go the next step? This is going to be really important here for Eagle County. It's been so tough because the people that were affected first, and many of the people that were died, not just in Eagle County but statewide, they tend to be people that people know, meaning the most social among us were some of the first that were stricken down, right? Of course, it's stricken down others that are not social, but those who interacted with many more people got it more. So a lot of folks, we lost some real iconic people in our state that many people knew, and it's really symbolically important that Eagle County was able to work hard, doing great jobs, starting earlier than the rest of the state on county health orders, and now get to this place where by the end of the week they'll be able to move forward. So we're looking forward to working with county health departments across the state, both to stamp out outbreaks and hot zones, as well as areas that have succeeded in making sure they have the hospital capacity, the testing, their electeds are on board, their county health's on board with moving forward. These steps are really guided by this model that you just heard, by a lot of important information nationally and internationally, as well as additional stakeholding. We look forward to, and we have heard from so many others, so many industry associations, county elected officials, state legislators, scientists and epidemiologists all over the country, as well as in Colorado, and I would even add internationally. Next steps, draft guidance will be released before the end of the stay-at-home order around what these things look like, that phase-in that we talked about between April 27th and May 4th, how we can make, what parameters, for instance, retail stores that want to reopen May 1st, what do they need to do? They can go to curbside delivery right after the stay-at-home ends, April 27th. But the situation, of course, remains in flux. And it remains, we will make adjustments in real time based on the data and modeling. I maybe didn't make this deck, but it was in a different slide deck that we showed, that we are really monitoring and updating in real time all this information, meaning try to use real-time proxies like mobility data. Then it goes to the next step, which is people that are diagnosed, symptomatic, then hospitalizations. Finally, are they released or do they die? Those things are, a good 2 to 3 weeks after the contagion. But we have some earlier indicators and some later indicators. This will all be adjusted in real time based on this. Of course, if cases start to increase, then clearly it's not hitting the mark, and additional steps at the county level or perhaps even at the statewide level would need to be taken. As I've made clear, and I've said this a number of times, just because we've reached, April 27th or May 1st or May 4th doesn't mean that we have the same life we had in January and February. It's not a time for anxiety. It's not a time for fear. It's a time for caution. It's a time for informed decisions. It's a time for calculated risks. It's a time to be careful. It's a time to be safer at home when you can, but be able to live in a sustainable and fulfilling way, psychologically, emotionally, economically, putting bread on your table as we prepare for the long haul, whether that's a month or 2 months with the adjustments that need to be made depending on the health situation in each county, working with each county. Folks should still stay at home whenever they can, and many Coloradans have that luxury, right? I mean, some of you have jobs you can work from home, and you can continue to do that all in May. You're lucky, you're blessed, you don't have to put yourself at risk. And you should do that and avoid going out whenever you can. You can have your groceries delivered. And many Coloradans are retired and really need to do that, right? If you're not working in your 70s or 80s, stay at home except when absolutely necessary, right? I mean, your May will look a lot like your April if you're in that most vulnerable group. But again, it's a marathon, and getting ready for that marathon so that we don't overwhelm our ICUs or our hospital beds or equipment so that everybody who gets this has a fighting chance of staying alive. And the odds are in your favor. The odds are in your favor for staying alive. But if we don't have that first-line therapy of oxygen, the additional therapies along the way, or the final intervention of ventilators, the death rate would be much higher from this deadly virus. And every Coloradan deserves a fighting chance. It's going to be touch and go for a while. County health, depending on real information, even with more scalpel-like focus in communities. Again, I hope in many ways, if it has to be done countywide, it would be better if it's done if there's an outbreak in a neighborhood or a plant, right? I mean, that's an even more targeted intervention. But it's times it will be neighborhood-based, facility-based, county-based, or state-based in terms of making sure that we complete this marathon and that Coloradans can get through this. And that we're able to do this in a way that's sustainable for the time that's needed. Some communities will have restrictions in place longer or shorter than others, but the statewide stay-at-home order, as that rolls off, that's of course the good news we've been looking for. Nobody likes to be told that they have to do something, and now it enters the time of individual responsibility and choices, and I trust the people of Colorado to make good choices. I know that the retailers, the other businesses will be able to do business in as safe a way as possible over the next few months. And let's also be clear, the only reason that Colorado is able to move forward in this reopening is because you have been staying at home successfully. Thank you. You've avoided going out except when absolutely necessary. Many of you are wearing masks. We go on one walk a day with my family and my dog, and we're so happy to see many more people wearing masks. Now at all the critical retailers, they're wearing masks. Nursing homes, senior care facilities wearing masks. And folks are doing a very good job staying at home except when absolutely necessary. Thank you. Thank you for your patience. There's no government, county, or state that can keep you safe better than yourself, right? We try to issue guidance, science-based, data-based, thoughtful. want you to be as safe as you can as you do what you need to do to enjoy life, knowing that you won't have that life we all want back for several months, but also knowing that you can't stay at home forever and that we have cabin fever and we're ready to move on. But we need to move on in a way that's sustainable for a month, 2 months, however long it takes to be able to get that 75 to 80% less social interactions down to 60 to 65% less social action. So let me just end on one thing, because a lot of folks have been asking, well, what about the testing, or what about this, or what about that? As Dr. Herlihy and Dr. Samet's model showed, no one of these things is enough. And to be clear, if we had all the testing in the world right now, all the testing we wanted that we could deliver, it might mean that the social distancing, instead of 60 to 65%, maybe it would be 50%, right, for the next month. And we would love that. You could do more at 50% than you can at 60 to 65%. But we don't have all the testing we want. We're rapidly scaling it up. We have 10 times as much testing as we did when we started. Many county healths that we're supporting, Eagle County is there with regard to their ability. Many other counties are stepping up, and private providers and hospitals. But that means that where we need to be with these interventions, protecting the most vulnerable, wearing masks, testing and isolation services, all of these things combined are what we need to do, along with the precautions that we take at our workplaces and when we're shopping, to be able to have a sustainable way that we can get through this psychologically, emotionally, and economically. Thank you for your patience. Most importantly, thank you for staying at home. We're not out of the woods yet, but we've successfully bent the curve from those exponential numbers that showed our hospital system being overwhelmed because you've succeeded at staying at home, and we just need to keep it under that capacity in the weeks and months ahead in a way that allows us to live fulfilling lives. Thank you, and we're happy to take some questions.
Governor, how about a reflection point 5 weeks in? If 5 weeks ago you were able to predict the numbers we have right now, number of cases, number of deaths, number of hospitalizations, would you have said 5 weeks ago that this is a number you'd be happy with?
You know, there's no way that any of us are happy with, what are we at, 449 deaths. That's not something to celebrate. That's something to mourn. Each one of those deaths, you know, is a loss that the family experienced, the friends experienced. But yes, compared to losing tens of thousands of Coloradans, if our hospital system was breached, if no interactions were taken, if people did not stay at home, it shows that Colorado is handling this global pandemic in a responsible way. And as we move towards handling it in a sustainable and responsible way, we'll be updated and informed by our decisions in real time in the weeks ahead.
Governor, can you go through some of these bits a little bit closer? So the stay-at-home order is definitely ending Sunday, and then we get into that safer-at-home period. We don't know how long that lasts, but it sounds like the safer-at-home period is kind of like the stay-at-home period, except instead of an order, it's a recommendation. Is that all correct?
Yeah, orders are awful. I mean, there's no, there were a few, ski resorts that closed, and I, had to do an extremely painful order to close all of them. To order people to stay at home is not an aspiration of any governor, of any elected official. I am thrilled. I am excited that has succeeded, and that order can end as we move to the phase of individual responsibility, if we move to the phase of sustainability. Because the thing about an order, and even though it's an order, there's never any criminal enforcement of that order, right? It's just saying this is important enough to be called an order. It's still extremely important. It's every bit as important as it was. But we have to be able to go to a sustainable way of living, meaning there are so many Coloradans who don't have the luxury of being able to stay at home and work from home and be home whenever they want. They need to be able to earn a living, and thank goodness they got hopefully the $1,200 from the federal government, $2,400 for a couple, and that's what they've been able to get through these last few weeks, and some people are getting unemployment or applying for unemployment and will get it. But for many Coloradans, for this to be at all sustainable, they need to be able to earn a living, and we need to have an economy that functions. We can't be frozen for months. I mean, on the one hand, you can say, well, why doesn't, if you're just coming at it from the public health perspective, you say, great, everybody can stay at home till September, October, and the virus will be stamped out in Colorado. Well, that's not feasible from a social perspective, from a psychological perspective, from an economic perspective, from no perspective other than a health perspective. Is that feasible? So our role in this is really to figure out how to wed the public health goals with the social and psychological and economic needs of the people of Colorado, and make sure that everybody who contracts the virus has a fighting chance and that we don't overwhelm our healthcare system. Telephone, please.
Governor Charles Ashby from the Grand Junction Daily Sentinel. This morning, the Mesa County Board of Commissioners approved 3 letters to you, one of which admonishes you again for wanting to keep all of the state CARES money for the state to balance the budget, an issue you addressed last week. 2, to criticize the state for signing a lease for 50 surge beds here in the county, saying that we don't need it, and that they're concerned about it taking too much resources to operate when the local hospitals. And 3, their own request to you, similar to Eagle County, asking if they can do their own stay-at-home order and ease some of those restrictions. On that last one, are you going to look to local health departments to come up with their own plan, or are you going to give us a statewide plan that phases this stuff in? That's what they're talking about here in Mesa County.
So on the first one, Charles, that is simply false. There was never, and there isn't, an effort, first of all, it's not even the prerogative of the governor to set the budget, it's the legislature. But we want to work with counties like Mesa to be on their side in helping to get the federal government to step up to meet those local budgetary needs that we know are strained in Grand Junction and Mesa County, in cities and counties across our state. So we are on the same side on that one, and we look forward to working with the commissioners in the city to do that. On the beds, having those extra beds is a critical piece of being able to return to more normalcy sooner rather than later. We have having 1,000 or 1,500 beds, the step-down facilities, all of that gives the state and gives Mesa County the breathing room to be able to remove restrictions earlier rather than later without reducing the risk of overwhelming their healthcare resources. So it's extremely important. And if you look at the cost of 50 beds compared to the cost of keeping the economy shut for another day or 2, my goodness, that pays for itself in less than a day of lost economic productivity. So if having these beds, which it does help you open earlier, of course, we should support Mesa County and the rest of the state in opening as soon as possible. Having those beds in place is critical. We look forward to reviewing. The Department of Public Health will review the application just like Eagle County's. They'll need to show the things like they have the testing in place, they have the protections in place. I don't know exactly what they are requesting. Eagle County had very specific requests in there. But we acknowledge today, of course, that we are thrilled with local counties going above and beyond the state and being able to reopen sooner in a safe way, as long as they have that in place, the testing, the hospital capacity, the guidelines. So there'll be a more formal process for how they do that. But, we look forward to engaging in a constructive way with the Mesa County commissioners. And I don't think these shots across the bow are helpful to the economy or helpful to the public health. It would be more helpful to work in a collaborative way to get Mesa County open as soon as possible. Yes.
El pasado viernes usted anunció la creación de un grupo de trabajo para corregir las disparidades que el coronavirus ha acentuado. ¿Quiénes son los integrantes de ese comité que va a formar parte para estudiar esa situación?
Sí, el voz de los inmigrantes son una parte muy importante de nuestras decisiones y quiero oír más de toda la gente que vive en Colorado, incluido nuestros refugiados y inmigrantes durante todo el estado.
Governor, you described testing earlier as one of the tools in the toolbox, but it seems like you were kind of saying that the relaxed restrictions can kind of move ahead separately of that. Can you really decouple mass testing from these relaxations? How will you ensure that you're not losing control of that?
So, first of all, testing is great. We're working to scale it up with counties. Some have been moving faster than others. We want more testing. I want that to be clear. We have 10 times as much testing in Colorado than when this first began. There needs to be a lot more. It's a topic of the conversation I had with the Vice President the other day. It's important. But again, even if you had all of that testing, you wouldn't have the ability to follow up from a tracing perspective and a quarantine perspective on even a fraction of that. Even if you had that in place, it still wouldn't be enough per these models. You could have less social distancing, right? You could target a number like 50% instead of 60%. So that's what it gets you. That's what it buys you. And I don't want to underestimate that, right? If we could be at 50%, that might mean that, boom, restaurants were open May 1st, right? If there was so I mean, it makes a big difference in livelihood and economy. But that's what's used in the modeling is showing that continued ramp in testing and isolation. But at no point does that alone get you there. The disease is too widespread here, right? If you are in New Zealand or Taiwan, they can get there. They're islands. They control their borders. You can get there with the testing and the isolation, and certainly in Taiwan they did. In New Zealand, they have a fighting chance of it, and they may or may not contain it. You cannot do that in Colorado. Far too widespread, open borders with the rest of our states, people coming in and out every day. So that is not something that has ever been the goal here. At no point did we say we're going to eradicate the virus from Colorado. If that was the goal, I could guarantee failure. The goal is to make sure that as Colorado goes through this difficult period, people have a sustainable way to live, that we don't exceed the medical capacity of the state.
Governor, turning your phone.
Oh, one more to the phone, please. We want to give them a fair chance, and then I'll go to you. Phone?
Hello, Governor. This is Vinny Gowtry. I said Bloomberg News in Denver. Regarding your discussions with Vice President Pence, and I guess it was a conference call today with the White House, has the administration offered any new solutions regarding shortages of testing supplies? And what will it take to activate everything that you think you need in Colorado as far as testing?
So I talked to the Vice President, the President, Senator Bennett, Senator Gardner. We talked to the head of the CDC, the FDA, all every few days. I've talked to the Vice President in person in the last couple of days and on the phone. Today I asked about 3 different areas. One is the general frustration around some of the instant testing, the AVID testing, which the administration continues to tout. A couple things about that. First of all, the advantage of that is it's a 15-minute test. That's absolutely wonderful, right? That's great because it creates our ability to use it to screen employees at like senior centers, as an example. 2 limitations on it. One, it generally believed to have a lower accuracy rate than other testing, just to integrate that into how you use it. But the bigger one is we simply have plenty of the machines, but we don't have the tests. Only Abbott sells them. It's proprietary. I think we've gotten 200. We need thousands every week. And so, and Abbott is not selling them to states. They're all being bought by FEMA. So we are appealing to FEMA to get more Abbott instant tests because we have a very good use for those to screen workers at senior facilities. We also have the National Guard supporting screening at senior facilities and nursing homes already, but it would be helpful to have more of the Abbott Cepheid tests, proprietary tests. We also generally are working on the limitations around the extraction reagent for testing and finding alternatives to that. There's several promising ways to get around that have been demonstrated in labs. I've instructed our state lab to replicate those, as well as different protocols for different kinds of swabs that are in more common use. We're working with the county health departments to scale up their testing. We support the county health departments in doing that. Many of our private providers have continued to do that as well. But yes, many of the conversations with the Vice President, with the administration, are about testing because masks, we were buying high-quality PPE for our healthcare workers. We welcome any more that the federal government sends. That continues to be a topic of discussion, but we are focused on that here in Colorado. Obviously, the social distancing is something that the people of Colorado have to accomplish, that we want to accomplish with you, that we want to help the people of Colorado know the importance of this. And that's really going to be your accomplishment, not Donald Trump's accomplishment, not Jared Polis's accomplishment, but your accomplishment. Yes.
Several sources. Testing stopped, the promised testing did not happen. A day after it began, maybe as many as 80% of the managers tested positive. What do you know about the testing? Why did it stop? And do you support the plant reopening later this week?
So I've not heard any figure like 80%. I believe it's a very alarming number, but I don't. To be clear, I have not heard anything like 80% positive. I think JBS should show more transparency through this process. We, as a state, are doing the best we can, making information that we know available to you, as we do daily through these briefings and through the COVID-19 website. We want to make sure that it's safe for the workers at JBS before they reopen, and we recognize the importance of JBS to national food security. So we hope that they can reopen as soon as possible in a way that's safe for their workers, meaning testing, and of course also meaning what are the social distancing that takes place. By the way, people have asked about testing a lot. There's another shortcoming of testing, and this applies to JBS or generally. At least 25 to 50%, and possibly many more, of people who contract COVID are asymptomatic. They spread it, but they don't show symptoms. No one anywhere is anywhere close to the levels where you're testing random asymptomatic people. I mean, you would need to do 5 million Coloradans twice a week. No one's even talking about that, right? What you're talking about is testing symptomatic people and then targeted asymptomatic, meaning workers at nursing homes, right? But as you look at something like JBS or a plant, symptomatic should be tested. There's never going to be enough tests in any realistic scenario to test everybody who's asymptomatic. So that's why that social distancing has to be done, meaning whether that means fiberglass between workstations, wearing masks, all of those things, because at least half, and by the way, under some modeling that's been done and some tests that have been done around serological data in different parts of the country, it could even be 70 to 80% that can spread it without having symptoms. More people might have this virus than we think and are spreading it, and we still don't know why. It's mysterious why it's deadly for some, and others don't even have symptoms. I mean, scientists are publishing on this every day, but it's a huge mystery. Telephone, please. Help. They can open when it's safe for the workers, and when they make sure that the workers are screened and they can get back to work. We're working with the administration. Actually, I reiterated to the Vice President when I met him in Colorado Springs the other day, we need to receive the additional testing resources to be able to support the work of Weld County Health. Phone? Phone? We'll go back to phone. Yes.
What about summer tourism in the mountains? Will it be normal? How will that look for folks? And also, what about kids' summer camps? Are those going to be allowed? And with professional sports, Broncos, things like that, what can folks expect?
Well, you know, we can at least, you can make an old, if you haven't, this one was made by somebody much better than us, but if you have an old Broncos t-shirt, you could probably make it into a Broncos mask. We've some great ones that people in Colorado have made. Wearing, and it's baseball season now, it should be baseball season, wearing Rockies masks, wearing Broncos masks, that's the best that we can do right now to show the support for their teams. They'll be back in Colorado consistent with the time frame for when they're back nationally. And leagues have talked about how they might be able to do that in a safe way, whether it's to reduce capacity at stadiums or empty stadiums. They're all exploring that. And I've had discussions with the owners of our major teams, and we'll all be excited for that to return as soon as it can. What was your, oh yeah, so it's going to be hard for our mountain communities. That's one of the reasons that I'm going to go to Eagle County. This will be, you know, it's a very important milestone because it's symbolic of the state's movement from sprint to marathon. In Eagle County, which put in restrictions as a hotspot several days before the state did, now also by the end of this week being able to emerge from that before the state did, at great loss in the community. I mean, just you know, legendary community figures and people that everybody know around town that didn't make it. But as they get back going, as the rest of us get back going, we know that business will be slow, right? We know that while stores may be open, there's not going to be, nor does, you know, Eagle County even want, nor would they have the level that they would have in summer of tourism. It's going to be a tough time across our economy. I mean, two Colorado sectors that are being particularly hard hit: tourism and recreation and energy. So those are two important sectors in Colorado that are going to have a longer tail in the recovery. And that's why I support federal efforts to target relief for the tourism and recreation industry. We need to make sure we recognize the importance of tourism and recreation and hospitality to Colorado, and that areas that are disproportionately impacted by the reduced levels of tourism and the steps that are taken to keep people safe should receive additional benefits from the federal government.
We'll take one more from the phone.
One more from the phone.
Hi, Governor. Alex Rose here with Fox 31, hoping you're doing well. Today, the governor of Georgia also rolled back restrictions, but his order included restaurants. Georgia and Colorado are pretty similar in case trajectories and hospitalizations. When you look at the numbers per capita, there are a lot of bar and restaurant owners who are probably watching this press conference. I know that you have a goal of mid-May for opening that back up, but what do you say to those owners who still have to wait as other businesses open up around them before they can stop the bleeding of their business?
Well, thank you for sharing that news with us, because that will enable us to be able to look at the Georgia data, to be have the confidence to be able to move forward with the parameters around restaurant opening sooner rather than later. My goal for that is mid-May. Would love to have restaurants open by May 15th. We want to see what they look like, and we'll look at Georgia, we'll look at other places, make sure that that doesn't lead to a spike that overwhelms our healthcare system. But look, Colorado wants to reopen responsibly, sustainably, as soon as possible, in a way that reduces the risk level of completely exceeding our ability of our ICU beds and our hospital beds to keep up with the caseload. So nobody wants to eat out more than me, because while I enjoy cooking, I haven't had the time to cook this last week. So, I mean, we're eating with our family. I mean, peanut butter and jelly sandwiches for dinner, as many Coloradans are. And I look forward to being able to go out again. And I know it won't look like going out in January and February, but I'm hoping that not just my family, but yours, can patronize restaurants in Colorado sometime in May.
Governor, any role for contact tracing?
Yeah. So the contact tracing is just as important. It's part of the testing. So it frustrates me when people say we need more testing. Testing for testing's sake doesn't actually accomplish very much. Because remember, if you have flu-like symptoms, Colorado, stay at home, right? COVID, non-COVID, stay at home. If it's COVID, 9 out of 10 of you will recover at home and you can go out. If it's non-COVID, 99% of you can go out. Maybe 1% of you will still need to go to the hospital if it's a flu or something like that. But stay at home. Testing only has this epidemiological benefit when you couple it with the tracing and the quarantines that go along with it, meaning who did the person come in contact with? Let's put them in quarantine as well, rather than a statewide or countywide quarantine. How do you have a targeted one about who came in contact with an individual that tested positive for COVID-19? That's why there are enormous efforts at the state level, both through the app and online services and through the normal model of scaling up the amount of the ability of the state to do more tracing, quarantine, and isolation of those who test positive from COVID-19.
All right, you just finished listening to Governor Polis discuss the very latest in our continuing momentum moving forward to try and reopen Colorado. Hopeful that it will be trending in the positive direction. He hopes to be in Eagle County on Friday. The first application received to reopen a county in Colorado said he's hopeful actually that bars and restaurants could reopen by May 15th and that gradually more businesses could reopen after that April 26th deadline this weekend. That's the deadline for the stay-at-home order.